The heart is 4 chambers. There's a left ventricle, a right ventricle, and you can't see them very well, but the left atrium and a right atrium right here. But the first valve that you'll see is the tricuspid valve. This can become leaky or blocked in certain conditions. The most common condition is people who have high blood pressure in their lungs from high blood pressure over the years, and this can get leaky right here. And this is again the tricuspid valve. The second valve, as you see here, that is the pulmonic valve. This is usually not involved in many pathologies. It can get infected, it can get leaky, but also we can image this very well on our echocardiograms. But there are interventions, mainly these are done in pediatric population, but if they do become blocked or leaky, we do have valves that can be put in this position. The more common valves that are fixed, as you can see here, is the mitral valve. And as you can see, and this is part of the left ventricle, this is the mitral valve. Again, this can get blocked in what we call mitral stenosis, or it can get leaky as we call mitral regurgitation. And there are multiple interventions for these. Again, the standard is surgery, but now we have a mitral clip that can fix leaky valves, and we also will just have to do surgery for if it's stenotic. But sometimes if there's enough calcium around here, as you can see in this area that's called the annulus, we can put a valve inside this valve and restore flow to the heart. And then the last valve that you can see is under here. It's right next to the mitral valve. Again, in the left ventricle is the aortic valve. That's one of the more common valves that we see that gets blocked mainly. It also can be leaky, and we do have many interventions for that. That's what we call the transcatheter aortic valve replacement. That's the less invasive treatment for valves when they're blocked in the aortic position. This usually occurs in older people, but we do have options for you in the future for all of these valves, especially the mitral valve and the aortic valve. If you have any questions, please feel free to contact us at Alabama Cardiovascular Group, and we'd be happy to see you.